I'm Dr. Hassan Elbis. I'm a consultant obstetric and gynecology. Currently, I work at College of Medicine in Al Ain, University, for the last 5 years with a special interest in urogynecology. In addition, I work at Tawam Hospital and Al Ain Hospital as affiliated hospitals with the University. The causes for urinary incontinence among female are many. However, there are three main causes. The first one is pregnancy and childbirth. In addition, gender, which is being a female. Also, obesity is a third cause. However, when we look at the other possible causes like professional of the patients or the woman, whatever she's doing, particularly if she's doing a physical job in the form of lifting, straining. Also, there are other causes like medical conditions like chronic lung disease, chronic cough, patients who have chronic constipations. These actually could be contributed factors for the urinary incontinence. However, when we talk about the causes, we should actually look at the type of the incontinence, because what actually already mentioned about the etiology or causes is not actually applicable for some of the type of the incontinence. However, what actually already mentioned are related to particular to the stress urinary incontinence, which occur with the cough, sneezing, lifting, and heavy exercises. Regarding the age, yes, the age of the patient itself is contributing factors. However, it's actually it's a package, or it's a cumulative factors, including the patient age, including being pregnant and having babies. Also, we look at the type of the delivery itself, either it's normal deliveries, cesarean sections, also the size of the baby and the length of the labor itself. So yes, age of the patients or the woman is a contributing factors, but itself is not the main or the only risk factors. Before we commence the treatment of what we call non-surgical treatment for these women with urinary incontinence, we have to identify what type of incontinence they have. So either they have stress incontinence, which patient make the patient complaining of leaking urine and cough and sneeze, or lifting, or any physical exercises or activities. And the second group of women who will have urge incontinence, either they have urgency frequency or they cannot make it on time to reach the toilets. So this is very important before we start non-surgical treatment. So for the group of women who has stress incontinence, ideally we should refer them for physiotherapy in order to train them and teach them and show them how to do pelvic floor exercise, traditionally known as Kegel exercise, but also there are other modality of treatment which the physiotherapy can offer this woman. Also, in the past we used to have medication to treat stress incontinence. However, due to side effects of these medications, it's unlikely, or actually it's not commonly used in practice anymore. For the group of women who have urge incontinence, we start with changing their lifestyle in the form of reducing weight, as obesity affect their symptoms. Second thing, if they drink coffee, tea, or they smokers, or they take alcohol, we advise them to stop taking these supplement, or this either smoking, or stop smoking, or cut down or stop completely the caffeine and tea. Also, there's something we call bladder training. So same way we can explain them to the clinic how to do them, or we can ask the physiotherapy to advise them how to do a bladder training, which in a way it can help this woman symptoms. For overactive bladder, there are actually a list of medication they can be used for overactive bladder, what we call anticholinergics. There are many of them. and it's shown to be effective in treating this woman's symptoms. However, before we start the medication, we have to check if there's no contraindication for giving the medications, and also we have to explain the patient the side effect of this medication, because some patient might develop a side effect, and could be a reason sometimes for poor compliance or discontinuation of the medications. There are other modality of treatment for overactive bladder, which is non-surgical, such as a Botox injection to the bladder. Even it is invasive procedure, but classified under non-surgical. Also, there is a tibial nerve stimulator, which basically to stimulate the tibial nerve, and that's in a way will help these women's symptoms. So that's in summary non-surgical treatment for patients with overactive bladder. Definitely, these non-surgical has been proven based on various of studies published in literature, and from my own experience as well, personal experience in treating patients with stress incontinence. Now, when we talk about the stress incontinence, pelvic floor exercise, refer a patient to physiotherapy, lifestyle changes, for example, reducing weight, has been proven to be effective in treating this woman's symptoms. However, the patient has to be compliant and has to be, let's say, encouraged to do them, as they are not actually an immediate effect on her symptoms. It might take between 2 months to 3 months to start working on their symptoms. For the overactive bladder symptoms, definitely all medication I listed in previously, lifestyle changes, reducing caffeine, stop smoking, and alcohol has been proven to be effective in treating this patient's symptoms. And in fact, for overactive bladder, there are very few surgery for overactive bladder reserved for complicated and difficult cases who not respond to or actually what we call a conservative management for their symptoms. With my own experience for the last 5 years since I moved to Al Ain, United Arab Emirates, I dealt with many patients, with many women with this sort of problems. And yes, we use it commonly. We advise women to start with what we call conservative, or if you call it non-surgical treatment. Also, as far as I know from communicating collaborations with colleagues in the area and in the regions, most of these modalities of the treatment they recommend, and they started treating these patients with these problems. For the questions, if these women are aware of the availability, yes, if they are actually come to us and see us and we explain to them, they become aware. However, women who have the problem and they don't seek medical advice, majority of them, they're not aware of this modality of treatment, and they think this is part of their aging process. Therefore, I recommend to establish a system where or education system where to reach these two women with this problem in order to educate them and allow them to be aware of the availability of this treatment, and this could be a step to encourage this woman to seek medical advice.